With the wildfires burning across our state, the smoke is greatly impacting our air quality, and that has many Coloradans asking if this will raise the risk of getting COVID-19. Now, we're bringing that concern to our CBS 4 medical editor, Dr. Dave Hnida, and it's the first question on this week's Q&A with Dr. Dave, where we get all of your coronavirus questions answered. Now, Dr. Dave, there's so much smoke, even down here in the metro area. How are these wildfires affecting people who have the coronavirus, and is it making all of us more susceptible to getting it?
The people who have COVID right now, if they are hospitalized, really the wildfires are not making much of a difference. Filtration in hospitals are very, very good. If you have COVID and you are well enough to be at home, definitely you don't want to be venturing outside. If you are asymptomatic with COVID, and yet staying at home, the one thing you do not want to do is go outside, because even though you may not be having symptoms now, the particulates that are in wildfire smoke can wind up all of a sudden putting you in a position where you are in the hospital. Now let's take a look at people who are not sick. Does the wildfire smoke wind up making you more prone to wind up catching COVID? And the answer to that is we really don't know. I mean, let's think about this. This is the first time in history we've ever had to think about wildfires and COVID at the same time. We do know that smoke winds up increasing your susceptibility to catching COVID. We know that smoking is a risk factor, so is vaping. So we do recommend that everyone be very cautious with spending time outdoors when the air quality is poor. If you have underlying lung disease, underlying heart disease, or any issues like that, you definitely need to be paying attention. And if you're an exerciser, you really don't want to be going out and putting in a big exercise session or exert yourself, because you'll be inhaling particles deep into the lung tissues, and that will definitely cause some inflammation and problems. One quick note here too. A lot of folks are thinking, well, if the air quality is poor, I'm just going to put on my mask, I'm going to be fine. Unless you have an N95 mask, the masks we use to prevent COVID transmission, they are very good at preventing the spread of droplets, but they are not very good at preventing the particulate filtration. And so you really got to be cautious, thinking to yourself, well, I'm just going to put a mask on, I'll go out and do what I wish to do. It just doesn't quite work that way. Keep your eye on air quality and what's going on in terms of smoke in your area.
That is interesting, because I have heard many people say, oh, I'm going to go hike, I'll throw on my mask, it'll help with COVID and the wildfire smoke. So that's very interesting, especially for everyone getting outdoors right now. We're going to kind of be switching gears now. Researchers have been looking closely at the impact coronavirus can have on the heart. So even though it's a respiratory illness, can this also cause heart damage? Tell us about that.
Boy, it sure can. We always think of lungs when we think of COVID, but we do know it affects every other organ system in the body. And the heart in particular is a huge concern. A really big study that was done on this within the past month and a half took a look at people who really did not get very sick with COVID. They had recovered from COVID, and they were people who were generally on the younger side. They wound up doing heart testing on these people. Specifically, they did heart MRIs to just take a look at how these folks were doing. And it was found that 70%, 7 out of 10, had wind up having evidence of some sort of underlying cardiac muscle scar tissue or some sort of damage. Now, most of these people didn't even know it, yet there were others who did experience symptoms. They were having some shortness of breath, or they were having palpitations or other symptoms. So what does this mean for you if you are someone who has had COVID? It is something to be thinking about. Even if you're not having symptoms, your doctor needs to be speaking with you about having some heart testing done. And that would include things like an EKG to check heart rhythm. You'd want to be having some blood testing done just to check on the level of inflammation, potential muscle issues involving the heart, and then an ultrasound or echocardiogram of the heart, just to make sure that everything is okay. Even though you may be feeling well, you don't want to have any issues with the concern about long-term heart damage from COVID, which we do think can happen.
Wow, that's, yeah, very important information for people who have been going through that. Thanks for that information as well. So the governor has extended Colorado's statewide mask mandate for at least another 30 days. How has the mask order made a difference in our state, do you think?
Well, I think first thing you need to do in this situation is take a look at numbers. We're doing pretty well here in Colorado compared to the rest of the country. We're really in the lower 10 when it comes to COVID cases. We've been trending in that direction. Hospitalizations are down. We're generally in the 160s with daily hospitalization rates compared to, we're close to 900 per day just a couple of months ago. And then you take a look at testing results. Our positivity rates are dropping below 3%. So we're doing actually really well. Why is that? Well, a big part of that successful equation is wearing a mask. And so now you have people saying, well, we're doing well, and maybe we don't need the mask, or maybe we could begin relaxing some of the restrictions that we have. Well, actually, for a second here, you got to stop and say, well, what are we doing? We are beginning to relax because schools are reopening. And that is going to be a big test in terms of where we are headed. And I think keeping this mask restriction in place is a really good idea at this point in time. And I think before we think about getting rid of it or relaxing other restrictions, let's see how things go with schools reopening. We do not want to be one of those states that wind up reopening schools and then 3 days later having to close down because of quarantines.
Yeah, absolutely. That's some great advice, just to make sure those masks stay on as we continue to trend in the right direction. So Dr. Dave, thank you so much, as always, for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com.